everyone, let's see an NCLEX RN video based on cultural considerations of patients. Which statement reflects a culturally sensitive response to a patient's question? The options are: can you try to decrease your smoking while you work? How do your religious beliefs impact your healthcare decisions? What is the biggest barrier to you making a lifestyle change? When do you think it is possible for you to decrease your salt intake? When you see these options, you need to have in your mind nurses' behavior, nurses' words, and the actions must show cultural sensitivity. The nurse must use open-ended question when they are talking to the patient. Then only the patient will be able to explain their needs and feelings. When you consider these options, the second option, how do your religious beliefs impact your healthcare decision? That is a more open question where patient will be able to explain in detail about the religious beliefs and their healthcare decision so that nurse can have a better understanding and plan for the care accordingly. Moving on to the next question. Select the response that acknowledges that social factors place patients at risk for health disparity. So you have to find out a statement that shows social factors are placing a risk for the patient in assessing the health. Anyone can be poor and have limited income. That does not impact access to healthcare. Having faith and being religious help patients deal with health adversity. Many patients speak another language, but translation services help them a lot. Unemployment is a barrier that negatively impacts housing, food, and healthcare access. When we are seeing the first three options, it is something statement which shows some bias. Last statement, it shows the social factor unemployment that causes a risk for health disparity. So the answer is unemployment is a barrier that negatively impacts housing, food, and healthcare access. Third question. Which thought by the nurse suggests that nurse is considering whether unconscious bias is influencing his or her judgment? The options: all obese patients just make bad nutritional decisions. I wonder if my feelings about abortion made me say that. Is cultural awareness as important as cultural competency? Why do they all act that way? When the question again, if we are seeing, the nurse is considering whether unconscious bias is influencing her or his judgment. The second option is the correct one. I wonder if my feelings about abortion made me say that, because she is reconsidering the ideas and whether her thoughts are making her to take a decision, making her to do some judgment. So this is the answer. All others are just she is having some opinions about or judgment about other things, which is not a good one. So here I wonder if my feelings about abortion made me say that. Here the nurse is considering whether her bias, unconscious bias, is influencing her judgment. Fourth one, what is the most accurate description of the social determinants of health? Biological, socio-economic, psychosocial, behavioral or social factors influencing an individual's health, factors that contribute to health inequity, discrimination and healthcare professionals' bias, national standards that are used to develop culturally competent and linguistically appropriate patient care, services used within healthcare facilities to identify which patients require culturally competent care. When you see the question is asking what is social determinants of health. The answer is biological, Socio-economic, psychosocial, behavioral, or social factors that influence individuals' health. The others are wrong option. Which action by the nurse reflects the use of a cultural competency model to assess the knowledge, beliefs, and attitudes? Acknowledging that educational level plays a role in the ability to buy a home, believing that patients bring on their own illness by making poor choices, considering how similar spiritual beliefs are to those of another nurse, thinking about how one American Indian tribe member looks like another. When you see the option A, B, and D, that shows some blaming from the nurse's side, or she is looking the things in another way. But the third one, considering how similar spiritual beliefs are to those of another nurse, that reflect the use of cultural competence model to assess the knowledge, beliefs, and attitudes. Mrs. Eve from Taiwan is admitted in hospital. She believes in Chinese medicine. She is challenged by a low level of health literacy. What interventions might the nurse suggest to the interprofessional care team? Options: ask if she wants to continue to see the Chinese medicine practitioner. Locate family member who can translate or healthcare documents for her. Secure relevant patient teaching materials written in her native language. Talk only to her daughter and son-in-law to expedite all communication. Here, when we are providing care to the patient, we should always think about a patient-centered approach. Whenever you are seeing this question, the other options A, B, D, that is not related to a patient-centered care. But the third one, securing relevant patient teaching materials written in her native language, is good for the patient to communicate with you and also participate in the patient care. The nurse verbalizes annoyance and fear when learning about the visit to the Chinese medicine practitioner. The attitude best reflects which characteristic? Bigotry, discrimination, hatred, xenophobia. So here you need to understand what is the meaning of xenophobia. Xenophobia is the fear, intolerance, dislike, and prejudice against individuals from other countries. Here the nurse is having that annoyance and fear towards the patient. That is why she gets irritated when she understands about the visit to Chinese medicine practitioner. So the answer is xenophobia, and this xenophobia leads to destructive behaviors by the nurse, and that includes bigotry, discrimination, and hatred. They are behaviors. It's not a characteristic. What resources might the nurse secure to improve the nurse's knowledge of the cultural beliefs and values of Taiwanese patient? Calling the nurse manager to discuss the situation, consulting with the care coordination manager to discuss the class standards, discussing the patients with other staff nurses during hourly rounds, managing all communications quickly through the patient's daughter. Here, the nurse should have culturally and linguistically appropriate services in health and healthcare standards. So when she knows that, that will improve the nurse's knowledge on the cultural beliefs of the patient from another country or another culture. So the answer is consulting with the care coordination manager to discuss the class standards. Class means culturally and linguistically appropriate service. Which strategy reflects a nurse's ability to apply communication to culturally specific influences in an encounter with Mrs. E? Actively listening following a question placed to Mrs. E. Increasing the tone of her voice after Mrs. Eve appears confused, nodding to Mrs. Eve when she is speaking, quickly calling in the interpreter, then walking out of the room. To apply communication effectively, which is culturally specific, you should actively listen, following a question followed placed to the patient. The other things are like we are neglecting the patient. Nurse should be always caring and respectful. She should not be judgmental. The other response is increasing the tone of voice and nodding when she is speaking and quickly calling the interpreter and walking out. That all shows impatience. Hope you understood the answers related to cultural competence. Please do subscribe for more videos. Thank you.